Therapeutic boundaries are the set rules that govern the provision of emotional and mental health issues. Therapists should communicate these boundaries to their clients to be aware since it is their right. Certain ethical standards and restrictions actually reduce the therapeutic efficacy. The majority of therapists, ethicists, judges, licensing boards, ethics committees, and educators have condemned dual relationships between psychotherapists and clients. Counselors work within an ethical framework, meaning they observe clients' rights to preserve their well-being and minimize doing them any harm. Therapeutic boundaries are violated when a therapist non-clinically intervenes with a client, exploiting them. Competent therapists work with the required professional standards, enhancing good practice. What do I think about Arnold Lazarus' views on therapeutic boundaries and ethics? According to Arnold Lazarus, unquestionable ethics and restriction affect therapeutic effectiveness. Different therapy areas require specific training, such as working with children and dealing with marriage issues. I, therefore, support Arnold's perspective on therapeutic ethics and restrictions. Serious ethical violations occur during treatment, rendering patients to unnecessary events and costs since they are exposed to harm. Clients must be protected from exploitative and harmful therapists according to the major reasons provided for this prohibition and multiple partnerships. According to some, are not only harmful to clients but also impair the integrity of the therapeutic process. Clients such as those seeking mental health assistance are frequently in distress and are particularly vulnerable and suggestible. Many people believe that trusting and being vulnerable to their therapy is an essential element of the healing process. Clients such as those seeking mental health assistance are frequently in distress and are particularly vulnerable and suggestible. Many people believe that trusting and being vulnerable to their therapist is an essential element of the healing process. Clients have a moral and a legal right to information protection that they disclose to therapists during their sessions. Unless the therapists are required to disclose the information by law, they should not discuss it with any other person. Although not all multiple relationships are unethical, some lead to violation of therapeutic boundaries and ethics, such as sexual relationships. Sexual misconduct from the therapist or client is also a significant issue affecting therapeutic effectiveness. Therapists should engage in a negotiation process in multiple relationships to ensure that they are ethical, as Arnold indicated. Therapists should ensure that all clients are treated with parity and protect them at all costs. The negotiation process should enhance an understanding of each other and ensure that boundaries are observed. How do I intend to balance the issue of multiple relationships? According to Ethics Code, therapists should maintain professionalism despite how difficult it is to avoid multiple relationships together. Counselors should understand their role in patient healing journey and perform the necessary duties. The first way to balance multiple relationships is by engaging the client by providing them with essential information at the beginning of the treatment. Therapy should be considered. Therapy should maintain professionalism and treat patients with respect and dignity, yielding to a healthy therapist-client relationship. The second way is identifying the client where a therapist should ensure that the client's problem is related to their therapy field. Therapists must practice in areas where they are competent to provide quality treatment services. This will help reduce the possibility of building an ethical relationship by referring the patient to a relevant therapist. Identifying the client and their problem will also ensure that the therapist is not working with a family member or a friend. Finally, approaching multiple relationships with cautions. Therapists often face an ethical dilemma where decision making might involve violating ethical standards. Therefore, they should prioritize professional and ethical standards in any relationship with a client. In summation, multiple relationships can be ethical or unethical. Some are avoidable while others are not. Despite the circumstances, therapists should balance multiple relationships to maintain therapeutic boundaries and ethics. According to principles of ethics, patients should be treated with autonomy, confidentiality, respect, dignity, and professional competence. Therapists are human. Therefore, when facing personal problems, they should take a leave from work to avoid an ethical relationship with clients.